This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome to the program, Mon Health Talk. I'm Dave Wilson. This morning we're going to be talking about 3D mammograms and women's health in Fairmont. We've got three guests this morning, so let's get right to it and introduce them. We have Sarah Highlander with us. Good morning, Sarah.
Good morning. How are you?
I'm doing great. We also have Chelsy Harmer and Kim Radcliff with us as well. Good morning, Chelsy. Good morning, Kim.
Good morning. Good morning.
All right, guys, before we dive into our topic today, let's get to know you just a little bit better. We'll start with Sarah. Give me some background about your education, where you're from, and how you ended up with Mon Health.
I'm from Southern West Virginia. I was an ICU nurse for over 20 years before I went back and obtained a master's degree in women's health nurse practitioner and certified nurse midwife. So I joined Mon Health about a year and a half ago. I started at the Stonewall location and then moved to the Morgantown and Fairmont office in January.
And how did you end up going down this career path in the first place?
It's kind of interesting. Being an ICU nurse in the 90s, there was a lot of kind of uncertainty about women's health and how women presented with certain illnesses. And I noticed a lot of misdiagnoses or things that happened with women that shouldn't have happened because women do present different. So I decided that it was worth a look, and that's where my heart led me.
All right, Chelsy Harmer, you're next on the list, so I'll pose the question next to you. Tell us a little bit about yourself.
Hi, I'm originally from Petersburg, but I'm now in a small town called Shenton. I was originally a emergency room nurse for many years, and I decided to go back and further my education. I went to an online school at the time, Chamberlain University, and there I got my degree in nurse practitioner. I kind of got thrown into women's health. It was just kind of where the job led me, but I fell in love with it. I like helping women to better themselves and to get their daily mammograms and to obtain their health screenings as preventative measures. And I kind of went with Mon Health because a year ago we signed on with Mon Health. Previously we were formerly Woman Care. I really enjoy Mon Health. I feel like it's a good program, a good company to work for.
And finally, Kim, we can't leave you out. You've had time to prepare your answer now, Kim. Tell us about yourself.
Good morning. I am from the Central West Virginia location. I have been an X-ray tech for over 30 years, and I've been doing mammography for well over 20 years. I registered in mammography one of the first years that became one of the requirements to do mammograms, and have kept that up since then. I enjoy working in a women's healthcare setting here with Mon. I enjoy what they offer to this Fairmont community, and they saw the need. They opened the clinic here, and I feel like we're providing a great service to this community and outlying areas.
And I mentioned at the top of the show, we're going to get into 3D mammograms and women's health in Fairmont today. And Sarah, when it comes to any screening, any type of monitoring for any situation, the first question we get on this show is, well, at what age do I need to start getting that screening? What age do I need to start getting that test performed? So I will pose that question to you first. At what age should a woman start getting mammograms?
So actually, a screening mammogram should start at the age of 40 unless you have first-degree relatives with breast cancer, meaning your mom, your sisters, even your father. And at that point, you would get a first screening 10 years prior to their age of diagnosis. However, it's very important for a woman prior to 40 to know her own breast and to know how to do self-breast exams, because a small place can be found long before age 40 when the mammogram would be scheduled.
We're going to get into those screenings, what to look for, what 3D mammograms are all about. So we got a lot of information to cover, but I need to squeeze in a commercial break. Our guest this morning, Sarah Highlander, Chelsy Harmer, Kim Radcliff, and we're talking about 3D mammograms and women's health here on Mon Health Talk. And we're back in a moment on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Sarah Highlander, Chelsy Harmer, Kim Radcliff, Mon Health OBGYN. And Sarah, before the break, we were discussing mammograms and what age you start doing mammogram screenings, and you were talking about self-screening. What is that?
That's really for a woman to understand her own body, to be aware of what her breasts feel like, what's normal, what appears normal, and that way she has an empowerment to know if anything would be abnormal, to be able to advocate for herself to find out if there's anything of concern.
October is coming up. It's hard to believe October is coming up, actually. It starts on Friday. That's Breast Cancer Awareness Month. Chelsy, can you describe the different types of mammograms that are available?
Yes, so there's two different types of mammogram services that we provide. We do screening mammograms, which are just your routine screenings, as Sarah was saying, starting at the age of 40. And then we do offer diagnostic mammograms. These are more precise mammograms. They're mainly ordered for areas of concern. Say you have a breast mass that you noted. If you have skin changes or you're having nipple discharge, those would be reasons why we would be doing more of a diagnostic approach. Here at Mon Health, we do offer 3D mammograms. They're very precise. Being that it's October, hunting season starting to approach us, kind of a little analogy of why we use 3D mammograms is because they're so precise to a certain area. So say, for instance, we're about to go squirrel hunting. With the 3D machine, it's going to tell us that squirrel's up in the tree at the 1 o'clock position. It's just very precise 3D mammograms are.
Chelsy, that might have been the best analogy I've heard in doing this show for 3 years. I totally get what you're saying now.
Perfect.
And Kim, can you walk us through what a woman can expect when she comes in for the mammogram?
Certainly. The first thing we do is we have the patient fill out a history sheet. That history sheet tells us a little bit about that patient, when they started their cycle, if they're still having a cycle, if they went through menopause. We also get the family history. Who's had breast cancer? Have they personally had any type of cancer? From there, we move on. We examine, we get ready for the mammogram. The patient is placed into a half case opening in the front. We always take 2 pictures of each breast, one from the top, one from the side. The breast is placed on the imaging plate, and a plastic paddle is brought down to use the compression. Once the patient is in position, the exposure is made, and it automatically releases the compression once the exposure is over.
You know, Kim, it seems like, and not just this screening, but any type of a screening, we tend to build things up in our minds as being a lot worse than what they are. So I say this a little tongue-in-cheek. It's not as nearly as bad as you might think it is, right?
It's not. I do a lot of women that come into our clinics that have never had a mammogram before. We do a lot of baselines in here. I go over it very clearly with them. I talk to them throughout the exam, telling them what I'm doing, why I'm doing it. I feel if the woman is educated and she understands the why, it's all possible.
And Sarah, what exactly, when a patient goes for a mammogram, what is that going to show once you've gone through the screening process? What are you looking for there?
You're looking for any kind of questionable areas of concern. even densities would show up that you might have to follow, cystic areas, or, of course, anything that would be concerning for cancer.
What is breast density, and how does that play a role in all this?
The areas of your breast that have more fat tissue or adipose tissue sometimes will appear thicker or whiter to be concerning, and you're not sure if there's something underneath it. And at that point, Kim would bring her back for a diagnostic exam along with an ultrasound to make sure that there's nothing of concern under that area of tissue.
Kim, is this where the 3D mammogram comes into play, like you said, where you can really pinpoint what you're looking for?
Yes, yes. The benefits of 3D is it improves the ability to screen for and detect potential breast cancers. It helps pinpoint in size, shape, and location of abnormalities, and it gives us a much better look through the dense breast tissue.
Sarah Highlander, Chelsy Harmer, and Kim Radcliff are our guests this morning. We're talking about the 3D mammograms at Women's Health in Fairmont, Mon Health OBGYN. We'll continue that conversation on the other side of this break. You're listening to Mon Health on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guests today, Sarah Highlander, Chelsy Harmer, and Kim Radcliff, Mon Health OBGYN, Women's Health in Fairmont, and we're talking about mammograms. And, of course, October, which starts on Friday, is Breast Cancer Awareness Month. So, Sarah, a woman goes in, she gets her mammogram, something abnormal pops up. You talked about going to see Chelsy and Kim, and they're going to do a much more pinpoint mammogram with a 3D mammogram. But what's the process from that point on that, okay, something out of the ordinary is here, we need to get looked at? What happens next?
Then we would make a referral to a breast specialist or a surgeon, and they would go in and evaluate the area and possibly at that point do like an ultrasound-guided biopsy to see if there is any signs of cancer at that point or if a surgical process would need to be performed.
And Chelsy, why is it important to do these screenings, to get them done on a regular basis?
It's always important to find something small before the area becomes larger and is a much more concern at that point.
Yeah, we hear that time and time again. Again, this goes back to what I said kind of at the start with all these screenings, that preventative medicine is much, I don't want to say easier, but much better than having to react after the fact. And if you can find it early, it is certainly much more treatable, correct?
Very correct. You don't want something to turn large and turn metastatic at that point. Then we're looking into chemo, radiation, and further concerns, and we don't want to have to go down that route, especially like Sarah said in the beginning. If we start simply by just doing self-breast exams, monitoring your breasts, understanding what your breasts feel like normal, so you can find that abnormal when it does appear.
Kim, what are some of the concerns you hear from women and patients coming in for the first time to get screenings done?
Most of them are nervous because they've heard horror stories about breast compression. And I just talk them, I do their comfort, I let them take control, like they're driving the exam, and they find that they tolerate the compression, and it's not what they've been told. It's not that bad.
Yeah, like we said, we always build these up in our head to be something much, much worse than what they really are, and you usually go through them and go, oh, that's all? Not the story that I heard.
Women.
Hey, Sarah, we've been talking about these screenings. Where can we find you guys? Where can these screenings be done?
We are on Locust Avenue in Fairmont.
Are there other locations as well?
Yes, you can also come to the Mon Health Hospital location, and I do believe also in our Uniontown area.
All right, mammograms offered Morgantown, Fairmont, Grafton, Weston, Kingwood. monhealth.com/mammogram is the website you can go to for more information. And obviously, Sarah, when we're talking about breast cancer, we're mostly speaking about women's health, But, and we always throw this in there, breast cancer is possible in men too, although a lot of people don't know that, right?
Yes, and actually it is becoming more and more prevalent. And if you have a male relative with breast cancer, as a female, your risk for breast cancer increases.
Why is it becoming more prevalent? Any insight into that?
I think that the education for men is actually becoming more aware, and men are actually becoming aware that this is something that they need to be screened for and watched for.
And to be honest, it would never cross my mind unless somebody told me. Like you, somebody told me that. That would never cross my mind.
Correct. We all have the same breast and adipose tissue, so we're all equally at risk.
Sarah, what's the best part of your job?
The best part of my job is helping women to learn and be aware of their body. I always say self-awareness is empowerment, and the more knowledge and empowerment a woman has, the more she can advocate for herself.
Same question to you, Chelsy. What's the best part of your job?
Just helping women, getting these preventative screenings, getting to know my patients and being able to talk with them on a personal level. Just knowing that I'm helping make a difference in their lives, whether it be cervical cancer screening, breast cancer screening, or seeing them meet their objectives and their life goals.
Kim, you know what question's coming.
The best part of my job is providing a service for women that is a screening tool that prevents something down the road, putting them at ease so they'll come back year after year for their mammogram and finding something small before it becomes something that's too big and out of control.
And, you know, that's a good point to end on, Kim. If it is a pleasant experience, then you won't mind coming back year after year to get those screenings done, will you?
Exactly. And that's what we provide here in our Fairmont location. We want it to feel like home. They come into an office setting. I grab them within 5 minutes of them registering, and they're in and out in 20 minutes.
Guys, thanks so much for your time this morning. I appreciate it. Coming up top of the hour, you've been listening to Mon Health Talk on WAJR.